Hello, I'm Charla Johnson and I'm your friendly ENTPA, and I just want to talk to you today about the removal of either a mucocele or a fibroma. We discussed mucoceles or fibromas, and if you didn't see my TikTok from a couple of days ago, I suggest you go back and look at that and you'll know what I'm talking about removing. But I talked about what is this in my mouth, doc, this bump in my mouth. And so we're going to talk about two things, but we're just talking about mucoceles, which are the soft water balloon type lesions, or the firm, non-movable fibroma. The mucocele can come up because you've bitten your lip, or for some odd reason something hot touched the mouth and then it caused the salivary gland to get blocked up. And once it gets blocked up, it just swells up kind of like a water balloon, so it's soft and squishy. If it's a fibroma, it's usually because something is irritating that area in your mouth, like your braces or some type of mouthpiece that you're using, or your gold grill doesn't fit right and it's rubbing up against your gums or your cheeks and it's irritating you, okay? And it can cause a lesion. So the mouth, usually its reaction to you is if you do something to it, then it will do something to scare you, and that is grow something in the area that's being irritated. So what the ENT doctor or the oral surgeon would do is do a oral exam. They will look in the mouth. They'll look on either side of the tongue. There's an area called the trigone area, and they look for ulcers or something like that. They'll ask you questions like, if you remember how this happened. Sometimes you don't know because you didn't even know it was there. They'll ask you if you have pain when you swallow, if it bleeds, if you have pain in your ear when you swallow. Only if you have pain in your ear when you swallow. That usually can mean that there's something in the jaw area back behind the tongue, but not with the oral lesions in the mouth. They will feel on your neck, along the neck, in several areas to check the lymph nodes in the neck to make sure that that is not a malignant lesion. Most of the time, a mucocele and a fibroma are normally benign lesions. A mucocele normally is for the most part, that's a benign lesion. A fibroma could be something else, but if you don't have any lymph nodes in your neck, if it's been there for a while and there's no bleeding with it, doesn't move, it hasn't changed in size, then you shouldn't be afraid that it's cancer. And I'm telling you this so that I can calm you down. Now, we're going to talk about just the prep of removing it, because that's what this particular episode is about. We will spray your mouth with some stuff called hurricane spray. That will kind of numb it up. It's got a cherry taste, weird cherry taste to it. Then we inject you with the needle like you see here. We inject around the lesion until it blanches or turns whitish. You're not going to see that. We will. And once you have that done, you should feel no other pain. There's two types of ways to remove it. It's either through a punch biopsy, or we will do a shave biopsy. The punch biopsy, we take this circular tool that you see here, press it into the area and twist it a couple of times. Then we pull it out. We grab these pickups like you see here and grab the lesion, go under it with the scissors that you're looking at right now, and we cut under the lesion, pull it out, put it in a cup, formalin cup, and send it to pathology for them to tell us what it is. That's what we do for both lesions, whether it's a mucocele or a fibroma. We do the same thing if it's a punch biopsy. If it is a shave biopsy, we take the pickups that you see here, we take a 15 blade, we pull it up, and then we just shave straight across, and we will make a smooth, right across the plane area. Now, if it's right across the plane, or it's a teeny 3 millimeter punch biopsy, then we will use silver nitrate to close it up. If it's a bigger lesion, then we normally have to put in the sutures, and it's probably 2 to 3, sometimes 4 at the most. And we will do that to keep it from bleeding, especially if it's a deeper lesion. Those sutures dissolve on their own, so you don't have to worry about that. Once you have the surgery done, for 3 hours, don't drink anything hot. Otherwise, it'll cause the area to bleed. Don't drink anything hot for 3 hours. Now, common sense would tell you don't eat any spicy foods, citric juices, or salty foods, because if you get that in the wound for the next 3 days, that's going to burn, okay? I wouldn't suggest you do that. Otherwise, everything is great. Everything's gravy. They'll tell you in about 7 days what the lesion is once pathology gives them the information. Okay?